Right. Well, I'll be the first of the two Peters. I'm very much building on Suri's closing comments there. The title of this workshop was Understanding the Economics of Microbial Threats. And certainly from my perspective, my understanding of the economics of microbial threats has been advanced by this workshop, both in terms of what we actually know, but also the limitations and gaps, the things we don't know and the things we could do better. And I hope I'm not unique in feeling that my understanding has been advanced. Just a few of the takeaways from me. And I'll say some of these things, particularly with a sort of wearing my Global Fund hat. To start with, the analysis of the burdens and risks attaching to microbial threats is really important, because if we don't have that, it's really hard to build an investment case for doing anything about it. And I think that's particularly the case in a world where we seem to have got better at dealing with some of the mortality consequences, but actually we're becoming more economically vulnerable. So interconnected is the world in terms of both social media, communications, transport, and trade. And that is, wearing my current hat, very immediate. I have to build an investment case for a replenishment round in 2019, so I have to go out to ask for a serious amount of money, and I need a pretty compelling investment case. A second is that economic tools can be incredibly helpful in both designing the optimal interventions and also in making the inevitable trade-offs, the inevitable choices we have to make in resource-constrained environments, and whether that's models or whether it's the sort of tools and frameworks of behavioral economics. That last point, I think, we under-leverage. And I've got a number of different things we're facing. If I just take the HIV world, there are countries where somebody who's been diagnosed HIV positive, before they get on antiretroviral therapy, they have to pay a small fee. This is even when we are paying for all the actual antiretrovirals. That act of having to pay for a fee typically creates quite a high fall-off between the people who are diagnosed HIV positive and those who actually get onto antiretroviral therapy. And at least, even if we get them later, it's a delay. The cost to our program, in terms of the effectiveness of the program, relative to the amount raised by the fee, is just, it's completely out of kilter. And it's a classic sort of behavioral economics thing of that little, we're talking relatively small amounts of money, but they create an impediment and a hurdle to getting on with therapy. Another example from the HIV world, biggest number of new infections is adolescent girls and young women. When you actually do qualitative research onto the attitudes and fears and concerns of these young women, they're actually much less concerned about becoming HIV positive than they used to be, because treatment, one of the downsides of effective antiretroviral therapy, as it has made people less worried about becoming HIV positive. Now that's a huge achievement that we've managed to make what was a fatal disease into much more of a chronic condition, but we have to work through the consequences of that in terms of the incentive impact. Obviously, we have some very hard economic problems that have been surfaced in the discussion. So a good example is the sort of market failure issue around incentivizing R&D into new antibiotics. A second would be however much we have exhorted and tried, the reality is the amount of money being spent on preparedness in low and middle income countries is, a whole lot of them have done JEs. Very, very few of them have done much in spending money to implement plans to fill the gaps identified by those JEs. Some of the issues, we do have silos. One of the things this workshop was trying to do was to help bridge some of those silos by getting people talking together, both across the division between economists and people from the public health world, science and clinical world, but also within both worlds, the silos between emerging and outbreaks, endemic diseases, and AMR. I do think we have work to do to make our approaches to economic analysis across those domains more consistent, more grounded in empirical evidence, and also not just at global level, because the reality is most policymakers pay only marginal attention to global numbers. They're much more interested in the numbers affecting Zambia or Nigeria or Vietnam or so on. A lot of discussion in this last session about need to build a knowledge base and capabilities, data gaps, and so on. I think the fascinating intellectual challenge of working out how to do the economics of fear, I think is a huge issue, but a really interesting and really important issue. We need to build capacity. Absolutely, we need to build it at a local level. Frankly, I think we have just a global lack of capacity in this arena. I don't want to pick on you, Anna, but I'm very conscious that in the world of TB, it's quite hard to find something on the economics of TB which you haven't written, which is great because it's great stuff. But it suggests that we've got a rather narrow pool of people working on the economics of the largest infectious disease killer in the world. I mean, it's just the aggregate amount of intellectual effort we're deploying in this space is just not enough. Somehow we have to find a way of making the economic issues around these things kind of sexier and more attractive to young PhD students and so on. So we build that capacity. Because ultimately, I think we need to get better at weaving economic considerations at a high quality of rigor and empirical basis into health strategy. And we need to get health considerations woven in more effectively into economic analysis. Because I can tell you most macroeconomic analysis has very little health stuff woven into it. Last thought, and it's come up in a number of times in different ways, I think we have to be careful that we don't take too narrow. Economics can very easily get very kind of mathematical and techie. The economics we're most interested in here, I think, is political economy. It is economics attached to political decision making, and we need to keep our scope broad enough, because ultimately, if we want to affect policy making and policies, we have to weave in that political consideration. So that's it for me. I will now hand over to the other Peter. Thank you.